Doctors of Reddit, what is the rarest disease that you've encountered in your career? Rare and interesting would be pathology of Cantrell, which has the heart outside of the chest because the sternum has not fused. I've seen it before with just a bit of the heart on view, but with this kid it was completely out. You could see pretty much the whole heart with the aorta and lung vessels, all that was holding it. The heart just beating away. I'd done adult cardiac for a bit, but this was a little different. Tiny. We covered it with a polystyrene cup until the kid went on theater to have it pushed back inside. It's meant to be in one of 65,000 live births. I saw a 9-year-old with something like that. She was born somewhere that had pretty bad healthcare options. So it was basically her family winning the lottery to get packed up and shipped to somewhere they could do the surgery. Sometime in the very early 80s, a friend of the family gave birth to her son. The boy's heart was outside his chest, and his intestines were wrapped around his torso. The doctors immediately sedated the mother before she could see him, wrapped the child up, and handed him to his father. They rushed to a waiting helicopter and were flown to Children's Hospital in Pittsburgh for immediate surgery. The kid turned out fine. The patient was admitted for something unrelated, but he starts deteriorating for no discernible reason. He has some mild generalized abdominal pain, but other than that, no specific symptoms. However, he keeps worsening to the point where he's barely hemodynamically stable. On the abdominal contrast CT, there's fluid everywhere, organs pushed against the abdominal wall, just one enormous gray puddle from the top of his pelvis to his diaphragm. And then, at some point, there's a scribble of white, pretty much smack dab in the middle of it all. In this context, signifying active bleeding. It was shaped like the world's smallest firework pop, and it was nowhere close any major vessel. Everyone was dumbfounded for a hot minute. It turned out to be a spontaneous automatic rupture of the cystic artery. No surgeon in the building had ever seen one. The dude underwent embolization and made it out completely unscathed. So his entire torso was full of blood? This sounds strangely like my uncle, who recently went to the hospital for pains related to his kidneys. He's been in dialysis for 7 years. And they found he was bleeding internally and looked like he was on death's door. They kept pumping him full of new blood while they waited to confirm where the bleed was, and he eventually got a surgery to cauterize the wound. He's been otherwise fine since then. Your arteries can just explode for no reason? What the hell? Pseudocyesis, or hysterical pregnancy, in a woman who was an inmate in the psych wing of a prison I rotated through. She thought she was pregnant with Jesus's triplets and had grown a massive pregnant-looking belly, was producing milk, and so on and so forth. I really wonder whether it's cognition trying to make sense of hormonal imbalances or the other way around. I'm a veterinarian, and dogs get a version of this. They get enlarged abdomen, milk, and will sometimes mother or carry around and cuddle with puppy-like things like toys or rolled-up socks. Wow, I've seen a couple of mental health patients convinced that they were pregnant with Jesus, including one who simultaneously claimed to be Jesus, but never one with physical symptoms. Did she have any abnormalities on scans or bloods? I've had a pseudocyesis patient as well. Oddly enough, her beta HCG, or hormone indicating pregnancy, was elevated, but she had an empty uterus on ultrasound and no evidence of ovarian cysts or tumors or whatnot to explain the elevated HCG. And the patient denied any recent intercourse, but still believed she was pregnant with sextuplets on the right side only. Gorham's disease, or vanishing skull syndrome. A softball-size area of my patient's skull disappeared and left behind a soft spot. She ended up with a plastic plate to protect her brain. Crazy disease. My cousin had this and had a hole in his skull behind in his ear, about the size of a quarter. He constantly complained of dizziness and ringing in his ears for years and finally went to the hospital for it. Must have been driving him crazy. He always thought he was just crazy. What do you mean by disappeared? Like part of her skull fell off? Melted? Absorbed back into the body somehow? Where does it go? It apparently gets thinned out and absorbed by the body and is replaced by something softer and no longer bone. That's how I understand it anyway. Actual scurvy. Poor old man didn't know how to cook after his wife died and ate nothing but biscuits. God, this makes me worry about my own pops. After the divorce, he basically subsides on hot dogs, chips, and uncooked ramen. Every time I cook for him, he reacts like I just gave him a 3-star Michelin meal, even when it's something as basic as quick spaghetti that I still can mess up. I accidentally gave myself scurvy during a bad depression episode. Thankfully recognized the symptoms from my forensics and osteology professor talking about it years ago. Makes me think of Kurt Gödel, the mathematician who would only eat food prepared by his wife. When she became ill and was hospitalized for several months, he starved to death. I get scurvy. I take much larger doses of vitamin C than normal to keep the symptoms away. It's kind of crazy how much vitamin C my body wants. The doctor says I'm pretty normal otherwise and I'm not overdosing. The body just likes vitamin C. Fibrodysplasia ossificans progressiva, or FOP. A disease that calcifies soft tissue and turns it into bone. When I was a medical student, our group's cadaver had this disease. During dissections, we sometimes would get poked by spiky pieces of bone in random areas of her body. She also had a spine that resembled a small turtle shell. I scrawled the thread looking for this, as my sister has FOP. She's now 36 and a lot more is known about the disease than when she was a child. The lack of information in her youth led to several misdiagnoses, and attempts to treat her or operate her actually caused flare-ups which can quicken the spread. There are 2 skeletons of individuals who had FOP at the Mutter Museum in Philadelphia. That was insane to see in person. Their lives must have been hell towards the end. A good friend of mine has this. He's getting to the point where he has to decide if he wants to be sitting or laying down for the rest of his days. Brutal condition. This was my rarest as well. The spookiest part of it is that at some point you have to make a call on how you want to be permanently stuck. We had a patient once, a young girl, who was so sick that it broke our data analysis pipeline. When the code ingested a genome sequencing sample, it attempted to detect the chromosomal sex of the patient. It was using 2 metrics. The sample was considered female if it, lacked the Y chromosome, and was heterozygous on X chromosome, implying that there were two copies of it. Otherwise, the sample was considered male. This one sample registered as female on metric 1, meaning there was no Y chromosome, but male on metric 2, which was not anticipated and resulted in our pipeline crashing. Upon investigation, it turned out that the parents of that poor girl were brother and sister to each other. As a result, she had very little genetic variation throughout her genome, not just on her X chromosome, and was consequently very sick with a plethora of diseases typical for consanguineous births. Walking corpse syndrome, or the Cotard delusion. 17 years in mental health, and I've seen it once. The belief that some or all of you is dead. The guy was so certain he was dead, he believed he was a zombie. You might be interested in how people are enslaved as zombies in Haiti. There's a cultural narrative about becoming a zombie and being controlled by the one who resurrects you. Victims are poisoned and subjected to a ritualized death and resurrection. Then their slaver doses them with a drug each day. They believe they're dead and have to serve the person who resurrected them. I don't remember the details on the drug used. I'm a schizophrenic, and I've certainly had delusions that I was dead before. I don't know if it would be the same. It was less I thought a part of me was dead and more that I had already died, and my perspective was a death trip, kind of like a dream. Reminds me of the now deceased Per Dead Olin. He was a black metal vocalist from the band Mayhem. He got obsessed with death after being clinically dead for a short while as a kid because of a ruptured spleen. People who knew him when he was alive tell stories of him burying himself to get corpse wax under his eyes and on his body. He would even bury his clothes for several days so they would start to decay and then wear them. Before live shows, he would smell dead animals and he'd sleep with dead animals under his bed so he could always be around death and decay. He would paint his face to look like a corpse, not 'cause it was cool, but because he felt dead. That last one was too creepy for me. I like the world of the living, thanks. I remember my father telling me of a rich guy who used to sleep in coffins, just for the heck of it. I was a kid when he told me this story, and I found myself wondering, maybe the guy felt safe sleeping in one? Maybe it kept him humble despite his massive wealth? Was my father just pulling my leg? I don't know. I myself like sleeping in my fluffy bed with my favorite duvet. That's it for today's stories. Hope you enjoyed, and I will see you again tomorrow for another episode. Bye. She was born somewhere. Oh God, I'm so sorry.